Okay. So, time to start. Okay. Good evening, and thank you very much for joining. And we are starting our first lecture in this series now today. And this is an important lecture because we'll be talking about a newborn child who has taken birth. And before I start, let me share my screen. Okay. Okay. So, I hope my screen is visible to all of you.
Yes, sir.
Anybody can see? Okay. Okay, fine. So we start with a basic question. Suppose this child has taken birth in India, in any part of the India, and it may be a urban metropolitan city, or maybe a tier two city, or maybe an urban slum, or maybe a rural area. What do you think are the chances for this newborn child to survive, or to whether he'll be able to grow normally, or whether he'll become malnourished? How many of you think uh, that he will be able to grow normally? Anybody?
Yes,
Will
sir.
you like to answer this question? What are the
Yes,
chances
sir.
for this child? Yeah,
Sir, maybe 30 to 40% chances of becoming malnourished.
30 to 40% chances to become malnourished. Absolutely correct. Depending upon uh, where the child is, has taken birth. That is point number.
Yeah.
And as you said, there are 30 to 40% chances, and we are the people in preventive medicine. So it is important to prevent the occurrence of this particular phenomena. Is it or not?
Definitely, sir.
Yeah. And that is only possible if we know how the child is going to grow, what are the requirements which are important for this child to get, whether the genetic potential of a child who has taken birth in a metropolitan city or in a rural area is similar for growth or different. That is the question number two, which comes to mind of everybody. Where the child has taken birth in a metropolitan city and child has taken birth in a rural area, what is the genetic potential to grow? What is the genetic potential to grow? Whether genetic potential is similar in both the children, or it is different in different circumstances. So the answer is that the genetic potential to grow is same. It is the environmental factors, right, and the child rearing practices which are going to make a difference. So yes, you gave me the correct answer that there are chances that this child will become malnourished. Now we go to the next one. That is important to understand to which domain this child belong. When I say domain, I mean to say whether this child, now newborn child, belongs to a obstetrician, or belongs to a pediatrician, or belongs to a preventive medicine specialist. To which domain this child belong to? Normal child, he does not have any problem. It is not a low birth weight child. It is not a premature child. But uh, what are the to whom this child should go, basically? Or what are your experiences where these kind of children who have taken birth and they may be in a hospital setup, where when we are saying that 90% of the uh, deliveries now being conducted in institutions. So after 2 days, the child comes back home, and then to whom this child should go, or should not go anywhere. It is the mother who will be able to take care of everything.
Any physician available can take care of the child.
Any physician.
Like
Okay.
any medical officer, or the first preference is the mother. But if she
Mhm.
needs any medical help, She can
Mhm.
go to any PHC medical officer or an health worker.
Okay, let me put the question in a different manner. Because we all are people from public health, and so what are the various programs which are running for the care of these kind of children? If there is any program by which the child can be provided a home visit.
Home-based newborn care.
Yes, home-based newborn care is one, and again, that is not universalized still in our country. And
HBNC.
few HBNC, yeah, that is home-based newborn care. Again, that is important to understand. But then HBNC again, the visit is being done by the ASHA, and she is supervised by the supervisors and maybe the coordinators, zonal coordinators, which are there, put in by the UNICEF or the other agencies which are there. And we have started home-based newborn care in our Uttar Pradesh. Okay, fine. That's wonderful. So the context is now in front of all of you. So first of all, we'll have to know what is normal growth. What is normal growth? Now, it is defined as the level of growth which is and can be attained by the child when its innate genetic potential for growth finds full expression. That means in a situation where dietary and environmental constraint on growth are eliminated. Meaning by that, if the growth potential, genetic growth potential is such that if you give them the similar kind of environment and similar kind of the practices, then he will be able to attain the growth potential. Now, how the child grows, that is important. When a child has taken birth today, initially the child will lose weight because of the edema and other things, and gradually, right? By the 10th day, the child will attain his birth weight. That is the point number one to remember. Suppose if a child is born with a birth weight of 3 kg, then by the end of 10th day, his weight again will be 3 kg. That is normal. After that, the growth will start. But before we come to that growth, it is important to understand, because majority of time, as all of you must be knowing, that 90% of the deliveries are being conducted in institute in our country now, and only 60 to 65% mothers are able to give exclusive breastfeeding. So there is a big lack as far as the breastfeeding is concerned. So it is important to understand the requirement, because again, it is very common to know what is the requirement, what is the fluid requirement, or what is the milk requirement starting from day one. So it is easy to remember. When the child is born on the day one, we calculate the requirement of fluid, whether it is milk, whether it is fluid, or whether it is IV fluid, maybe which is to be given to some low birth weight children. And in a normal child, I am talking about, and the requirement is 60 ml per kg. And every day you will keep on adding 10 ml. So second day it will be 70 ml per kg. Third day it will be 80 ml per kg. Fourth day, it will be 90 ml per kg. Fifth day, it will be 100 ml per kg. And on 10th day, it will be 150 ml per kg per day. So that will be the requirement, right? That you'll have to understand, this is the requirement. And this 150 ml requirement will continue from day 10th to first year of life. It will remain same. Why it is important to understand? Because when we'll be talking about the illnesses, then you'll have to know what is the maintenance fluid requirement, because everybody talks about the deficit, but nobody talks about the maintenance fluid requirement. And that is why when we give therapy, especially in the children who are suffering from diarrhea, then there comes a problem, because all of you remember the deficit, but you forget to add the maintenance requirement, right? So from day 10 to 1 year, the requirement is 150 ml per kg body weight, depending upon the weight of the child, right? So that is, you'll have to remember. Suppose, and the another take home passage, which all of you must remember, that by the end of first year, a male child at least Standard is the male child should weigh 10 kilogram. Male child should weigh 10 kilogram irrespective of the birth weight of the child. And how this can be achieved, we will be talking about all these things gradually over a period of time. So we have covered the fluid requirement, right, up to the age of 1 year. Then fluid requirement decreases because again it is important. We will not be concentrating only up to the age of 1 year. We'll have to move forward. From 1 to 4 year, you reduce 25 ml per kg. So from 1 to 4 year, the fluid requirement will remain as 125 ml per kg body weight. From 4 to 7 years, it will be 100 ml per kg body weight. From 7 to 11 years, it will be 80 ml per kg body weight. And from 11 years onward, it will be 60 ml per kg body weight. So this will remain the fluid requirement into the up to the adulthood. So you'll have to remember this thing in your mind, that this is the fluid requirement and you can calculate the requirement in this manner. This is the maintenance fluid requirement, right? So this is important to understand. Now coming to the growth of the child, we finished there at the 10th day of life. And after the 10th day of the life, if the child is exclusively breastfed, then how is he going to gain weight? A exclusively breastfed child with adequate nutrition in the mother will gain approximately 30 grams per day. 30 grams per day. I am repeating, 30 grams per day. So in 1 month time, how much the child will gain weight? Anyone? If the child is gaining 30 grams
1
per day
kg.
in approximately 900 grams. So this growth velocity is maximum in the first 4 months of life. Growth velocity is maximum in the first 4 months of life. And I'll be talking about it a bit later, right? This particular slide. So initial 4 months, the child will gain by this speed only. That means in the first 4 months, the child will gain somewhere around 3.6 kilograms. How much child will gain? 900 grams per month. So for 4 months, the child will gain how much? Approximately 3.6 kilograms in the 4 months, right? That is important to understand. Then
Sir, can
after
you
four,
please go slow?
okay, okay, I'll speak slowly. So again, uh, I can go back. After the 10th day of life, the child will gain 30 grams per day, and in 1 month time, the child will gain 900 grams. So in 4 months time, the child will gain how much?
3.6 kg.
3.6 kg. Absolutely correct. So you have been able to understand it. So after the 4 month of life, the growth velocity decreases, right? Okay. Then what
Yes.
happens? It comes down to approximately 20 grams per day. But after 4 months of life, the child also starts getting the various kind of infections. And it is documented that even with the practices, that means when the child is given exclusive breastfeeding and the child is started the complementary feeding at the right time, even then child will get 3 to 5 illnesses in the first year of life. Whether it could be ARI or it could be diarrhea, even then that is it. And every illness will result in a weight loss. So we decrease the average weight gain after 4 months of life and it becomes 15 grams per day. 15 grams per day. Now, how much it is there? 15 grams
Per day.
per day. So in 1 month time, how much the child will gain after 4 months of life?
450.
15 into 3, 450 grams. Correct?
Yeah.
450 grams the child will gain in 1 month time now after 4 months of life. So there are remaining 8 months up to the age of 1 year. So in 8 month times, how much the child will gain? Child will again gain 3.6 kg,
3.6 kgs.
right? So 3.6 kg plus 3.6 kg, how much does it give you? It gives you a figure of 7.2 kilograms, right? 7.2 kilograms, right? And the average weight of an Indian baby is 2.8. Agreed? So if you add 2.8 to 7.2, what is the figure which you are getting now, right now? It is 10 kg,
Hmm.
right? So the take home message are three here. Number one message is that the growth velocity is maximum in the first 4 months of life. Correct? Because child is gaining 3.6 kilograms in the first 4 months, and then he is getting 3.6 kilograms in next 8 months. Okay? Is it clear to everybody?
Hmm.
Okay, fine. So the growth velocity is maximum in the first 4 months. So that is the point number one. The point number two is the every child has the potential to go up to 10 kilogram by the end of first year. Okay? Right? And then what happens afterwards? It
सर
is
फीमेल्स में भी 10 kg आएगा 1 year के बाद.
female में थोड़ा सा कम होगा. It will be somewhere around 9 point something, like that. But in my experience, if you use the best practices, or if the mother or if the parents they implement the best practices, even the females they attain the weight of 10 kilograms. They can attain the weight of 10 kilograms. I will again prove it with the help of a WHO chart. So that slide will come a bit later. I don't want to hurry. I want to go slowly. So why I have kept this 4 kg and 4 kg? This I have kept it for the community point of view. You see, from the community point of view, it is easier if you say, like we used to play this game at our urban health center with the mothers, that we used to draw a circle, right? And then used to ask them, and we used to draw a bottom line, and where we used to write 0 to 12 months, right? And then we used to ask that if the child is going, how much the weight the child is going to gain, or when this line will cut, half line in the period point of time, period point of view, 0 to 12 months, if you cut it half, that it will cut at 6 months, right? But the child is going to attain the weight of 3.6, or for them round figure 4 kg in the first 4 months, and next 4 kg in next 8 months, just to explain them the growth velocity, right? Just to explain them the growth velocity. Now I will show you another slide, and that will be again important, and I'll prove all this with the help of a WHO growth chart. This is not my finding. These are my observation and analysis over a period of so many decades, and that is why I came to these conclusions, right? Then we come to next weight gain in the next 4 year of life. This is the weight gain in the next 4 year of life, and which is constant. It is only 2 kg per year. We can go back, see the previous slide. Growth velocity is maximum where? In the first 4 months of life, where the child is going to gain 3.6 kg. Then it reduces to 50%, right? Of the first 4 months, because now the child is taking 8 months times to get another 3.6 kg. Agreed? Is it clear to everybody? Yes
sir.
or no?
Yes sir, yes sir.
Okay. And if we keep a figure of 4 kg in mind, approximation, I'm not saying it is absolutely correct, but to remember it correctly, and if we go further, then you see what the child is now gaining. What the child is gaining in the first year of life, if we go back again, in first year of life, if we add 4 kg and 4 kg, of course it is 7.2 kilograms. But for round figure, if we say, for example, for ease of understanding, it is 8 kilogram. The child is gaining 7.2 or 8 kilogram roughly round figure wise in the first year of life. Okay. And then in next 4 year of life, that is from 1 to 2 years, 2 to 3 years, 3 to 4 years, and 4 to 5 years, child is gaining only how much? 2 kilogram per year. Meaning by in next 4 years, the child is going to gain how much? 8 kilograms. And how much child is going to gain in the first year of life? 8 kilogram or 7.2 kilograms, right? So if that is true, and we will prove it again, maybe in a next to next slide. So this is the weight gain in the first 5 years of life. In approximation, in the first part, it is, you can write it 7.2 kilograms also, right? But for the community point of view, it is important. If the community, you can make it understand to community that you see in the first year of life, child is gaining the weight which he is going to gain in next 4 year of life. So where should be your concentration? As a
First year.
public health professional,
First year of life.
where should be your concentration, right? And now again, I'm asking a question. We are running the biggest program in the world, in our country, by the name of ICDS, right? And we are running this program, and that is the only program which is going to take care of the nutritional status of the children in our country. And what is the beneficiary in that program? What is the beneficiary as far as the children are concerned? 0 to 6
6
years.
years.
And what should be the beneficiary? If you want to read more, I'm giving you, there is a Journal of West Bengal chapter of IPSM, and there is the editorial which I've written on 1000-day versus 635 days approach. We'll talk about it a bit later, right? So is it clear to you by now how the child is going to grow? Child is going to gain weight. Maximum weight gain will be in the
First year.
first 4
First.
months. That is first 4 months, right? In comparison, year-wise, the maximum weight gain will be in the first year of life,
First year.
and then the weight gain will be how much? 4 kg in next 4 years. That is the crux, that if you can understand it, then you are going to apply prevention. And here then comes when we say prevention every time. What is prevention? I will share my own definition of prevention here with you. We say there is no Sandhi Vichhed in the English language. So, but I have done a Sandhi Vichhed of the word prevention in English language, and I call it pre-event action is prevention. Simplest definition of prevention is 3-word definition. You can note it down, or maybe you can note it down later on also. It is pre-event action. In other words, action taken prior to the occurrence of any event is called as prevention. So now go back to the first question which I asked from you. What are the chances? And then one of you replied that there are chances that this child will become malnourished. There are 30 to 40% chances as per the prevailing condition in our country and as per the prevailing statistics which is available with us. So if we have to apply prevention, then we have to prevent the occurrence of malnutrition, right? And I don't know how many of you can understand Hindi. If all of you can understand Hindi, then I can share my experiences. When we were working in the field, and there are a lot of mothers who used to come to us, whether during immunization or for the treatment of their children. And when you used to find them that the child is not growing normally, or the child is going for growth faltering, or the child is going into the problem of malnutrition, has already gone into the problem of malnutrition, then we used to tell them कि बीबी देखो, आपके पास पहले साल में जो थैला है ना, वो है 8 किलो का लगभग, है ना? तब तो आपने उसमें सामान भर लिया 4 किलो या 5 किलो। अब अगले साल जो है वो थैला है आपके पास 2 किलो का, और आप उसमें 4 किलो सामान भरना चाहते हो, तो क्या भर सकते हो? What will be your answer? If you are a parent, right? And this question is asked from you that you have a bag in which you can put in, say, 7 to 8 kg weight of material, and you have put only 4 to 5 kg, and then next year you have a bag which can have only 2 kilograms of the material, and now you want to put 4 kg of the material into that bag. Is it possible?
No.
No.
That is why, that is what is the country's, that is what is the problem of the country, right? So we are trying to, because if you read ICDS in greater detail, we'll talk further when we'll be talking about prevention of malnutrition, right? So I thought, let me first talk about how the child is growing normally, right? So let me go back very fast to the growth chart, which I wanted to share with you. Yes. Now this is the WHO growth chart, not for me, not this is uh, again, if I can take a pointer from here. Okay. So now this green line indicates the 50th percentile. All of you must be aware with this, right? Right? This is the
Yes, sir.
50th percentile. Now, if we look at it here, it is showing you a weight of somewhere around 3.2 kg, right? And if you look at 1 year, this is 1 year, where it is cutting somewhere around 10 kilograms,
10.
right?
Mm.
You can see the pointer, laser pointer. It is where it is cutting.
10
It is,
10
it
kg.
is cutting at
kg.
it is cutting at 10. So what I told you, as per the growth, right? As per the growth velocity, the 50th percentile is 10 kilograms. So what I am talking about is not abnormal. That is normal. Now look what I have told you as far as the next 4 year is concerned, right? I have analyzed it. The data is already there. I have just analyzed it. Now see at 2 years where it is cutting. It is cutting at 12.
12.
Yes. 12, right? Now look at 3 years where it is cutting. It's cutting at
14.
14, right? You look at 4 years where it is cutting. 16. If you look at 5 years where it is cutting. 18.
Yes, sir.
Okay. Okay. So how much weight gain is there from first year to fifth year? 8
16
kilogram.
kg.
8 kilogram. From 10 to, from 10, this is 10 now.
Hmm.
First year is 10. And then from 10 to
8
18,
kg.
8 kilograms. And per year weight gain is how much? If you look at it, 4 years, again it is cutting at 14, 16, and at 5 years it is cutting at 18. You look at 3 years, it is cutting at 14. Then 4 years, it is cutting at 16. Look at 2 years, it is cutting at 12. 3 years, cutting at 14. So what I've told you is already there. Problem is this, that nobody is talking about it. Nobody is analyzing it in this manner. If you have this idea, then at least you can catch the child when he starts faltering in the growth, and you can take the remedial action, right? And then it is not based on these charts. There are formulas again. There are formulas, and I'll go back and tell you those formulas. Now, this is the weight gain in childhood. Up to 1 year of age, we have already told you that the child will go up to the age, can go up to the weight of 10 kilograms. That is take home message is clear to all of you. First message, I told you that the growth velocity is maximum in the first year of life. Second, in the first year of life, the growth velocity is maximum in the first 4 months of life, right? And after that, the growth velocity is 25% approximately per year of the first year, because it is only 2 kilograms, right? So you can calculate it. And again, I'll show you the formula. and then we can go to the growth chart and you will find it. What is the formula? From 1 to 6 years, you can, if you know the exact age of the child, you can calculate the weight by applying the formula age in years into 2 plus 8. Now what is plus 8 is constant and the multiplier factor is 2, which I have already told you that the weight increases after the age of 1 year by 2 kilograms. So suppose if the age of a child is 3 years, if the weight of the child is age of the child is 3 years, then by this formula, what will be the weight of the child?
14.
14. If it is 4 years, then what will be the weight of the child?
16.
16.
16. 5 year it will be 18, and 6 years it will
18.
be 20.
12 plus 8, 20.
20. Simple. So even if you nowadays even the weighing machines are available everywhere, but even if you don't have a weighing machine, you can get the pretty good idea by this formula. And this formula again is fitting it with the WHO growth chart, which I have already shown it to you. Then we go to the next one, that is from 7 to 12 years. 7 to 12 years. How do you calculate the weight? Again, there is a formula, which is pretty good formula. That is age in years multiplied by 7, then the whole minus 5 and the whole divided by 2. So, for example, if the age of the child is 7 years, if the age of the child is 7 years, then 7 into 7 will give you how much? 49 minus 5 will bring it down to 44. You divide it by 2, right? So it will be 22. It will be 22. So similarly, now can you calculate the weight of the child if the age of the child is 10 years? Simple. All of you can do the calculation and give me the answer.
32.5.
32.5.
Yes. So simple. So if you can remember this, you can remember this formula. It is easy. Age in years into 7 minus 5, the whole divided by 2. This will give you the approximate idea. And moment you take the weight, you know whether you are dealing with a normal child or you are dealing with a abnormal child. Is it or not? If does not fit in, say if you come across a child of 5 years of age, right, and his weight is 11 kilograms, what will come to your mind?
So under
5 years of age and the weight is only 11 kilograms, whether it is a male child or a female child. Do you think it is a normal child or it is a malnourished child?
Malnourished.
It is a malnourished child. So malnourished, we say with the various classifications nowadays, we are using the Z-score. Previous classification was IIP classification, where up to 80% we used to consider it to be normal, right? So by simply knowing the age, again, it is difficult to know the exact age in the community also. So you should have a weighing machine by which you can calculate, right? So that is the simple, because weight is very important to understand. Weight is the most important. Height is genetically determined. You see, you can't impact the height with the help of nutrition much. You can have the impact on weight. And if the weight is normal, then the height, which is genetically determined, the child will be able to achieve that, right? Then we go to the next. Again, it is important to understand why we are talking about it. Next one is your head circumference. Next one is your head circumference. Why head circumference is important? Why head circumference is important?
Brain growth.
Yes, brain growth. But again, we have to go to the head circumference first. So this is the slide which is showing you the head circumference. And now again, it will be astonishing for you to see because the God has given each child the two front nail, anterior front nail and the posterior front nail. They are not fused, right? Initially, the first is to fuse is the posterior front nail, and then later on the anterior front nail closes. Why the child God has given us front nail? Because the brain has to grow. Brain has to grow, and brain has to grow very, very rapidly. If both these front nail are not there, and if their sutures are closed, that is the condition which is known as craniosynostosis. Craniosynostosis, which can result in microcephaly. And if you read the causes of microcephaly, I hope all of you understand microcephaly means where the head circumference is less than 2 standard deviation than the normal, right? So at birth, the head circumference is 34 centimeters. At birth, the head circumference is 34 centimeter. At 3 months, it is 40 centimeter. Okay. And at 1 year, it is 47 centimeter. And at 2 years, again, it is only 49 centimeters. So you have seen the weight. Now look at the head circumference. And if the child is, you see, gets malnourished, then this head circumference also reduces. That means we are not talking about only the impairment in the physical growth. We are talking about the impairment in the brain growth or mental growth. So it is important that child must attain the genetic potential which the nature has provided, right? And if all of you try to measure later on, once the lecture is over, you measure your head circumference, you will find it will be somewhere around 51 or 52 centimeters. That is all. It does not increase after that, right?
Sir, for
So
measuring the head circumference, where should our measuring tape exactly should be?
yes. Again, I can answer it right now, but I think we can answer it when we'll take the nutritional assessment. Do you want to study the nutritional assessment also?
Yes, yes, yes.
Okay, you have to measure it from this glabella point and to the most prominent part of the occiput. That is the measurement. You have to take it in this manner, right? That is the method by which you'll have to measure the. You have to put maybe a steel tape. You take it around and go to the most prominent point on the occiput. So that way you will have to measure it. We'll talk in detail when we'll be maybe studying the nutritional assessment, right? So weight gain again is very, very important, and look at it. We said the maximum weight gain is occurring in which period of life? Maximum weight gain is occurring in the
First
first year of
month.
life, and then first 4 months. And here again, you look at it, 6 centimeter in 3 months, and another 7 centimeter in another 9 months. So they are running parallel. Now, this is not my data, this is a standard data which is there. So, weight is the most important parameter which people are not concentrating on, and people are not concentrating on the most crucial part of the life, that is the first year of life. Because after first year, you can see what is happening. What is happening? It is only 2 centimeter increase in the head circumference also. And the similar story will be there as far as the length is concerned. You see the length. At birth, the length is 50 centimeter. At 1 year, it is 75 centimeter. How much length has increased? 25 centimeter. And then see, at 2 years, it is 87 centimeter. How much it has increased again? 12 centimeter, right? And now see from 2 to 12 year, again, you can calculate it with the help of a formula. You can note it down. Age in years into 6 plus 77. So 77 is constant, and age is, you see, is changing every year, and the multiplying factor is what? 6. So every year there is a increase in 6 centimeter only. Okay. So simplest, I am asking you another question. At 4 years of age, what should be the length by this formula? 101 centimeter, right? At 5 years of age, what should be the length or height by this formula?
Yep. Five plus 6.
5
8.
into 6, 30 centimeter plus 77, 107 centimeter. At 4 year, how much it was? 101. At 5 year, it is 107. You just have to add 6 centimeter because 6 is the multiplying factor. Na? 77 is constant.
Hmm.
Similarly, at 6 years, what will be the age? 113. At 7 years, what will be the height? 119.
Right.
Similarly, you can keep on adding 6 centimeters and that will give you again. But then the most important point to remember here is from 2 year onwards, it is only 6 centimeter increase in the height, right? 1 to 2 years, it is 12 centimeter and the first year of life, it is 25 centimeter. So even if you have to prevent stunting in our country, you see, you will have to take action where there is a maximum potential to gain height. And this height gain is absolutely dependent upon the weight gain. If the weight gain is not there, then the height gain is going to be affected. And that is why when previously we used to taught or we used to read even in the WHO publications, we used to say there are three types of malnutrition. Nowadays another one has been added. There are three types of malnutrition. One is acute malnutrition, the second is chronic malnutrition, and third is acute on chronic malnutrition, right? So we will be talking about all those things a bit later maybe. So let me go back from where we started. We started with this, that yes, whether this child will survive normally, grow normally, or will become malnourished. I got the answer that there are 30 to 40% chances the child will become malnourished. And now you know the reason why the child becomes malnourished. And then I said कि कौन से डोमेन को ये belong करता है. This child belongs to us. You see, if we are running our centers, rural and urban health center, and if we can concentrate on infants altogether, right? I have followed more than 1,000 children from 0 to 1 year of life, and we have done all those interventions, and none of the child is neither malnourished nor anemic. Remember this. If you can do that, that is possible. And at various forum, I always talk about it. Can't we make our field practice area malnutrition free or anemia free? Can't we have 100% immunization? Can't we have 100% breastfeeding? Can't we have timely 100% complementary feeding? It's a question of passion, dedication, and devotion. If you can work in the field, of course, you'll see the result. And once you are able to produce the result, the community will have absolute faith on you. And I can guarantee you that you will also feel very, very happy and satisfied if you can prevent the occurrence of malnutrition, right? So we talked about the normal growth, then we talked about we also talked about the normal requirement, right? From 60 ml per kg per day on the first day of life to 150 ml up to the 10th day of life, and then that persists till 1 year of age, and after that you keep on reducing 25 ml per every 3 year, and gradually you come down to 60 ml per kg, and that is the requirement in adults also. Then we talked in detail about the weight gain in the first year, in all the years, right? Then growth velocity is maximum in the first year of life, and even in the first year, the growth velocity is maximum in the first 4 months of life. And then I gave you the various formulas for weight gain in childhood. Again, 1 to 6 years, age in years into 2 plus 8, and from 7 to 12 years, age in years into 7 minus 5, the whole divided by 2. Then we talked about the height and again gave you the formula for height also. Age in years into 6 plus 77. At birth it is 50, at 1 year it is 75, at 2 years it is 87. It is reducing. Then we talked about the head circumference also. And then I showed you the growth chart by which again I tried to prove my point of the weight gain in the different age groups. So that is what I wanted to talk today. If any question is there, I can answer. I can answer. So that is it. I hope you have been able to learn something new today. If yes, then thank you so much. If no, then we'll try to innovate further and teach you.
Sir,
If
one
there is
question,
any,
sir.
yeah, please switch on your video and then ask so that I at least know who is asking. Yes, who is asking the question?
Sir,
Tell your name. Yeah.
sir, I am asking that we have decided कि पहले क्वेश्चन में कि 40 to 60% चांस है कि बच्चा सरवाइव करेगा.
नहीं नहीं,
सर वो कैसे?
आंसर क्वेश्चन ये था कि whether this child will become malnourished or not. The answer was given that there are 30 to 40% chances as per NFHS 5 data. If you look at the data, I'll show you the data also later on, right? NFHS, you know what is NFHS? National Family Health Survey. There are 5 National Family Health Surveys which have been conducted from 91, 92 to the 5th one, which was conducted in the last, maybe in somewhere around 2021, right? So, as per the data of National Family Health Survey, there are approximately 36% children who are undernourished in our country below the age of 5 years, right? So that is as per the data. That is not I don't know who gave the answer. That is why I asked. If you are asking a question, the survival is dependent upon the infant mortality rate. We have come a long way. Then, if you look at the data which is given by the WHO, that 50% of the under 5 deaths are attributable to malnutrition. 50% of the deaths in under 5, right? So kindly read what is the infant mortality rate now. What was the infant mortality rate when we got independence? We have come a long way. You must understand. But then you will have to understand one more thing. That, like I said to you, that 50% of the under 5 deaths are attributable to malnutrition. Who loses you can say, who loses the fight in a war? Who is weak or who is strong?
Weak.
So that is simple phenomena in the war of life. Any child who is anemic, who is malnourished, will succumb to even mild to moderate illness, while a child who is normal will fight, right? Will come out even after a serious illness. So you'll have to understand this. I think you are in first year. That is why you have to study a lot, but try to read the salient finding of NFHS 5. When we will be talking in greater detail about the prevention of malnutrition, we'll talking about the causes, we'll give you the data of all NFHS. That is why I said this lecture is important, because if you understand now, all of you must be now clear in your mind how the child is growing, how we can find out whether the child is normal or whether the child is malnourished, whether the child is faltering. Suppose you come across a child of 3 months of age, right? And again, let me first give you another example. In all your books, it is written that the weight of the child doubles by 6 months of age. यही पढ़ा है ना अभी तक? हैं?
Yes, sir. Hmm.
यही पढ़ा है?
Yes, sir.
Let me try to share my screen, and then I'll again give you the example. Okay, okay, fine. So we have come to the growth chart itself. Now
Hmm.
see, the pointer is already there. Now here it is 3.2 at birth in this chart, 50th percentile. इसका डबल कितना होगा 3.2 का? 6.4. Now let us see 6.4 ये कहाँ कट कर रहा है देखो. I am putting it here at 4 months. Where it is cutting? It is cutting at 7.
Yes, sir.
Where it is cutting at 7.
7.
And Dr. Megha, you will agree this is not my chart. This is not chart is not prepared by me. This is a WHO growth chart.
Yes, sir.
Fine. So what the
Hmm.
book is saying, even in your park, it is written the birth weight doubles by the age of 6 months. But if you remember the 30 grams formula, 900 grams in a month, right? So in 4 months, 3.6. Even if the weight is 3 kilograms, right? It will double by 3.5 months or so. Correct?
Yes, sir.
But the mother should be well fed and mother should be giving exclusive breastfeeding to the child. That is why it is important to understand, right? So we will talk about breastfeeding also. We'll have 1 or 2 or 3 lectures on breastfeeding also. So FAQ based, the problems which the mother face and how you are going to solve those problems, right? So it is important. Yes, I am very happy that you are asking questions. I love your enthusiasm and I appreciate it. That you should ask questions. Whatever is in your mind, you should ask because you are not going to get the opportunity again and again. This I can tell you. And I'm sure that nobody has taught you in your undergraduation in this manner. I used to teach all this to my undergraduates also, right? So you must understand. So this will be, and majority of time wherever this is one of the very important lecture because until unless you know how the child is going to grow, you see you will never be. You will think it is a normal child. For mother, every child who is running around is a normal child, whether he is malnourished or not. Mother is not aware. It is, you see, you have to be aware. And if you are not aware, and imagine, I can think about it that if you are a postgraduate now, if you have not been taught like this, right? So how many mothers will be knowing about all this? You are a medical student, you are MBBS, and if you are not clear about all these things, how a lay woman or a mother would be knowing all this? So I say public health, even if you work 48 hours in 24 hours, still you cannot finish the work. And we have done it in our field practice area. You see, when the malnutrition or the undernutrition was 50%, we could reduce it to 28% in our field practice area. By simply sensitizing the mothers, the parents again and again, and the game is over by the end of first year. It is the game of first year of life, which is absolutely essential because if the child is able to attain the growth potential, then even if you don't do anything, he is not going to become malnourished. I can give you with example, another example. Okay, I say you follow the child up to the age of 1 year and after that you leave.
अनुपमा मैम तो
Please, who is this? Mute yourself or I have to mute all. Okay, I am muted all. So I am giving you another example. Suppose a child is attain the weight of 10 kilogram by the end of 1 year and then you don't do anything. And even if the child grows with a 50% of the potential now, Meaning by if he gains 1 kilogram per year, in 4 years' times, how much the child will gain? 4 kilograms. What will be the weight by the end of 5th year? 14 kg, right? Hmm? Now, what should be the weight by formula? 18 kg. What is the 20% of 18 kg? 3.2. You reduce 3.2 from 18 kg, what will be the figure? You will be coming somewhere around 14.8, right? Even if you don't do anything, even then the child will fall into the grade 1, right? Grade 1 as per the IIP classification. He will come in grade 1 when you are not doing anything. But important thing is, once you have been able to sensitize the parent in the first year of life, right? Then they are empowered. They will take care of the child and child will grow normally. That is to understand. Any other question which is there?
Sir,
I'll be happy. Try to answer.
sir,
Yeah.
sir, I have a doubt.
Yes, please.
Sir, macrosomic baby for macrosomia, this growth velocity will remain same or it will be different?
What are you talking about?
The
Macro?
macrosomia.
Can you explain what do you mean by macrosomic?
जैसे कि सर infant of a diabetic mother, uh,
Mm-hmm.
that in that case birth weight will be more than 4 kg.
Okay.
So in
Started.
that,
Okay. Let me try to come back to you. What I said we are talking about a normal child, right? Different situations will be different. There are children who are born with a low birth weight also, right?
yes, yes,
Right? There are children who are born as hypothyroid. They are also having high birth weight. Similar diabetic mother will have, and diabetic mother will not only have uh, a large for dead baby, like she can also have a premature child.
yes,
But those situations are different basically. First of all, let us try to concentrate on normal and try to keep normal as normal. Different special situations will come across, and I think if those situations are there again, then we should not tackle them. We should refer them to a pediatrician. You must understand the whole topic was integrating primary health care, child health care into primary health care. We are talking about primary health care, and this is all primary health care. We are not talking about any investigation. We are just talking about the basic minimum requirement. You should have a weighing machine. That's all. What else you need? We are not talking about any investigations. Special situations, yes, they are different. We will be talking about them if the time permits later on, or maybe one-to-one interactions will be there. You have my number and everything will be there. So let us concentrate on normal. Even if 80%, 90% children are normal, whether they are normal birth weight or low birth weight, we'll give you the examples of low birth weight also. And I'll try to break that myth which people say low birth weight don't grow. I have more than 100 children who were born as a low birth weight and could achieve 10 kilograms. I have children now, those who have become adult, those who have got married, those who have delivered a low birth weight baby, and their baby again has been able to achieve 10 kilogram by the end of 1 year. So 2 generations, not one. So what I am saying is, what I am trying to teach you and what I am telling you is not hypothetical. It is practical and with conviction. With conviction, and you rest assured, it's a long process. If you follow a child for 1 year, then yourself you will see. And if you follow a child for 5 years, then your perspective will entirely change. And I am again telling you, because we are running the centers and we have a fixed population. Follow up is much more easier. Even a pediatrician cannot do a follow up, that rigorous follow up, which you and I can do in the field practice area. That is again important to understand, because I believe preventive medicine is a practical subject, number one. Number two, it is a way of life. Once you believe in prevention, then you have to apply prevention in every aspect of life. Whether it is child health care, whether it is maternal health care, whether it is communicable diseases, whether it is non-communicable diseases, whether it is nutritional problem, everything is preventable. You have to enhance your knowledge, and once you are able to do it, then you will be able to apply prevention. It is the most practical subject, and I always say preventive medicine is the mother of all medicine. I will share one more link with you people where I have talked about from hygiene to community medicine. That's a lecture again on my YouTube channel. So if you will ask, I will share the link of that. Now all my YouTube channel lectures are on not on a public mode. They are on a private mode, right? So yes, okay. Will you be discussing what exact training is to be given to the mothers? Yes. You see, a very good question. You see, you will have to interact with the mothers, and when you can interact with the mothers, if you are running ANC care, so you will have to start interacting. And my personal experience is we used to have meetings with the mothers in the field. We used to call all pregnant women at one particular place, maybe 15, 20 mothers and their mother-in-law at one particular place. And we used to talk about all these in a simplified manner, where we used to draw a circle and say, okay, you cut it. This is the weight gain in, say, in the first year of life. These are the 12 months where half weight gain will be there. So majority of the mother will cut at 6 months. And then we used to teach them that, okay, no, it is not 6 months, it is 4 months, right? So that way, and then once they understand, you see, important aspect is to sensitize the mother. Once you are able to sensitize the mother that your child has got the potential, and every child is crucial, every child is very cute and pretty, and it is a gift of nature, it is a gift of God. You will have to take care of that particular child. Once you are able to sensitize the mother will be able to take it. And again, since you have asked Dr. Manjula this question, I can use another terminology, which all of you must be aware. Of course, the first year will not be aware of it. That term was BFHI, Baby Friendly Hospital Initiative, right? So people talk of Baby Friendly Hospital Initiative, mainly that you want to make a hospital baby friendly where you practice the exclusive breastfeeding. We organized a workshop way back in early 80s for BFHI. And then it struck to my mind, what are we doing? Why we can't convert it into BFCI? Now, again, my innovation, it's my term, BFCI. What is BFCI? BFCI is Baby Friendly Community Initiative. Why can't you make the whole community baby friendly? And we did it. We choose certain volunteers who were giving breastfeeding, and you see live examples are the best. And when the kids comes to you for your immunization clinics, then you can call those mothers who are giving exclusive breastfeeding, take their weight and compare the weight of the with the children of uh, those children who are not being fed exclusive breastfeeding, and you will see the difference in the weight gain. And then it will be clear to them that what they are not doing. Right? So it is important to understand. You will have to sensitize. But before you sensitize, number one point is that you yourself must be convinced. If you are convinced that yes, this is the correct thing, only then you will have the conviction. And once you will have the conviction, then you will have the confidence. Right? There are three C's. You should be convinced, then you'll have the conviction, and once you have the conviction, you will have the confidence. And if you speak with confidence with the community, then the community is going to listen to you. So there are 4C now. What are 4C's now? You should be convinced, you should have conviction, then you'll have confidence, and then you will be able to motivate the community. So that is important, and you have to do a repeated sensitization. We have done it, and that is why I thought, let me design this course in this manner so that all of you can be benefited and you can replicate it, because you are the change agents. I have done my part. I have done my part for 40 years now. So that is why it is important to do it. Any other question?
So this is Dr. Archana.
Mhm.
Sir, I had a question about the growth velocity actually after 4 months. It is
Yeah.
20 grams for how many months,
Yeah,
sir?
it is 20 grams, but then what usually happens is it is 20 grams, but what usually happens is when we say that even with the best practices, the is going to have infection, and every infection act as a catabolism, and the child start losing weight in every illness, and child lose weight in the range of 200 to 250 grams in every illness. You must understand this. So that is why even if the growth velocity is faster, but then ultimately it will come down because the child will fall sick. So that is why, and you can read Nelson, you textbook of pediatrics, you can read, it is written there that this is the growth velocity. But practically what is happening in India, you have to understand it, the best of practices. You see, viral illnesses you cannot prevent, and you cannot prevent people from coming close to the children and passing on the infections. So they get infected, right? And despite saying no, no, no to everybody, then there will be some amount of bottle feeding. There will be some amount of unhygienic practices, like not washing hand before giving feed to the child, right? When giving complementary feeding, then water problem is also there. So we'll talk more about the causes of malnutrition in greater detail. Then we will be touching all those things. So that is why it decreases. That is why in totality it decreases. And that is why you see, I have proven it with the help of a WHO growth chart. You see, what I have told you is there on the growth chart. You can see it again and again. You can see it again and again, and you will find the same pattern of growth. Why? Ultimately, these growth charts have been prepared by studying the children of 6 different countries on the mothers who are exclusively breastfeeding their children, and India is one of those countries. You see, problem in India, you see, I don't want to say it on a public platform, but this is my lecture room I'm talking about. In India, people try to hide the problem and then they change the standards. I have enough of criticism and enough of what you say, cynicism also. People who have not gone to the field, they don't believe in this. They say, oh, this is not possible. But when I ask them, have you ever followed up a child for 1 year? And I can say it with guarantee that 90% of the people in community medicine have never done it. You do it, and then you will come to know that yes, it is possible. Yes, it is possible. And you will be doing a great service to all those parents, as well as to the communities, as well as to the young children. They have the growth potential, but unfortunately their parents are not aware. Their parents are not aware. So we'll have to increase the awareness, and that is the first step. How can we increase the awareness? If you become aware, only then you will be able to increase the awareness. You start teaching to your students. Once you start teaching to your students, they will start teaching to the community. So we have a very big now. Now those days are gone where there were 350 medical colleges. Now we have medical college in every district of India. So if we join together, then yes, we can do wonders. We can do much more than what the healthcare delivery system is doing. That is what I feel. So that is important to understand. Yes, your question is valid. It is 20 grams, but then because of the illnesses, it goes down. And that is why if we add 20 grams, imagine for 8 months, if we add 20 grams per day, then what will happen? It will be 600 grams in a month. And in 8 months, it will be 4.8 kilograms. So then the 50th percentile will move from 10 to somewhere around 12. Right? I hope the person who asked this question is now clear.
Yes, sir.
Any other thing you want to ask? Okay, then you can uh, go through it, and we will meet again on Tuesday. And kindly tell your friends, those who have joined and still not joining. Uh, For me, it does not make any difference whether they are 10 or 20 or 50. I would love if all 50 are there, but then if they are not there because of the one or the other reasons, they are the losers, not me. I have to teach whether 50 are sitting here or 60 are sitting here. And if you think that yes, you have learned a lot, then yes, spread it and kindly switch on all your videos so that we can have a pic before we close down, and let me stop recording.